to order? Terrific. Wonderful. Hi, everyone. Welcome to the SURG Subcommittee, Prevention Subcommittee meeting. This is my first time as chair, so thanks in advance for your patience with my adherence to Robert's rules. I'm glad we have the DAG on the line and the SEI team to keep me in line. I'd like to start with agenda item number 1, which is a call to order and a roll call to establish quorum. So if Emma or Ms. Rodriguez, are you able to take care of that?
Yes, Jessica Johnson.
Present.
Debbie Nadler.
Present.
Angela Nichols.
Present.
And Eric Schoen. All right, Chair Johnson, we have a quorum.
Terrific. Thank you so much. Moving on to agenda item number 2. This is our time for public comment. So this will be received via the Zoom meeting. It will be limited to 3 minutes per person. And no action may be taken upon matters raised during this period of public comment. I know Ms. Rodriguez will just have a timer up for anyone and manage that. So thank you in advance for adhering to the time, please. Ms. Rodriguez, do we have anyone for public comment?
I don't see any hands raised. I'll give it one more moment. Chair, I am not seeing anybody indicating they would like to provide public comment at this time.
Terrific. Thank you. So we'll move on to agenda item number 3 then, which is to review and approve the minutes from our October 12th, 2022 Prevention Subcommittee meeting. These were sent out to the group in advance of today and posted on the website. So I will entertain a motion for approval of the minutes.
This is Debbie Nadler. I make a motion to approve the minutes for October 12th, 2022.
Wonderful. Thank you, Debbie. Do I have a second? Or do I need a second?
Well, Chair, this is a question I have possibly for Rosalie. Emma Rodriguez, for the record. Angela Nichols, I believe, was not on the Prevention Subcommittee meeting in October, so I don't know if she's able to provide the second, and she's the only.
Rosalie Bordelove, for the record. I get this question a lot. Just because a member wasn't present at the meeting doesn't mean that they are unable to vote on making the draft minutes the official minutes for the meeting. So they can still second and vote. Many like to put on the record that they weren't there, but they're relying on staff and the others for the content.
Great, thank you.
So then, would you need me to second then? I'm sorry, this is Angela Nichols for the record. Angela Nichols for the record, I second it, the motion.
Wonderful. Thank you, Angela. So I have a motion and a second. All in favor, say aye.
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 All right. Any opposed? And any abstentions? All right, wonderful. We have approved the minutes from October. Thank you all. All right, wonderful. We're moving on to agenda item number 4. We have a review of the National Academies of Science Behavioral Health Continuum of Care model, a presentation by Alyssa O'Hare from the Center for the Application of Substance Abuse Technologies. Alyssa, I will turn it over to you.
All right, thank you. Good afternoon, everyone, and thank you for having me. As she said, my name's Alyssa. I work at CASAT at the University of Nevada, Reno. Next slide. My position is 100% funded by SAMHSA, so I want to disclose that and just state for the record that these are my views and should not be interpreted as an endorsement by anyone at SAMHSA or the federal government. Next slide. So I only have a few minutes, so as fast as I am capable of going, I'm going to define prevention, talk about the levels of prevention as they connect to stages of health and disease, and then describe the spectrum of behavioral healthcare services, And then finally kind of conclude with how the levels of prevention align with the spectrum of behavioral healthcare services. Next slide. So this is the most generic, kind of widely accepted definition of prevention that I'm aware of. It's interventions offered prior to the onset of a disorder that are intended to prevent or reduce risk for the disorder. But I always like to add increase protective factors too, because that's an essential part of prevention as well and should not be omitted. Next slide. I think that the definitions for primary, secondary, and tertiary, I think this dates all the way back to like the 1940s. My public health history is a little fuzzy, but these definitions have been around for a very long time. For those of us who really are more in the upstream, we like to talk about this as in connection to stages of health and wellness. Treatment providers talk about it as stages of disease, injury, and disability. All are fine, all are great. But really it comes down to primary prevention is about reducing the incidence of disease well before it occurs. We're still in a healthy and well phase at this point. Secondary prevention, there might be some problems. We're seeing some signs and symptoms, and so we need to engage in a different set of interventions to kind of pull back and make sure that disease doesn't really take root. And then tertiary prevention, there is a disease now identified, or a disability has occurred, or an injury has occurred, and the goal is to help people get better, not worse, from where they're already at. Next slide. So way back in the 90s, the National Academies of Science, Engineering, and Medicine, formerly the Institute of Medicine, developed this really lovely fan. And this is a different way of categorizing behavioral health services by audience type. You can see there's 4 broad categories. There's promotion, prevention, treatment, and maintenance. And again, this is really specific to substance misuse and mental health promotion, the way that this was developed. And each of those categories has little different segments that refer to kind of a specific type of audience that would be ideal for that specific type of service. Also, I want to point out promotion cuts through all of these services. Ideally, promotion of general health and well-being, holistic health should be incorporated into all aspects of all behavioral health services, regardless of audience or service. Next slide. I'm going to kind of hone in on the 3 prevention segments, universal, selective, and indicated prevention strategies. And these are strategies defined by the audience they are intended to serve. So universal prevention strategies are for anyone in a given population. Anyone in a specified population will benefit from this, regardless of risk, regardless of use, regardless of mental health status. They will all benefit from this type of an intervention. This could be underage drinking laws, it could be Good Samaritan laws, or it could be classroom interventions. If your population is middle school, there might be an intervention you're doing in all middle school classrooms. But it's available and accessible and should be reaching everyone in a population, regardless of risk and regardless of use. Selective is a subgroup of that. And those are services for people who are at elevated risk. They have an identifiable risk that is of concern. But to our knowledge, they're not yet using substances, or they haven't yet developed a mental health problem. And we want to keep it that way. So an example would be, of course, every risk factor just went out of my brain. Early elementary school. If your population is middle school students, an important risk factor for middle school substance misuse is actually failure or academic struggling in late elementary school. So you might take elementary school students in like 4th, 5th, 6th grade, depending on how your school system is set up, and identify students who are struggling and offer them a combination of tutoring, mentoring, maybe some mental health supports to keep them from starting use in middle school. Indicated, they're already using. There is some experimentation, but there is not a use disorder developed yet, and they have not yet experienced harmful consequences. So there is still an opportunity to either reduce or stop use, depending on the substance and the age, what the true goal would be. But there's still an opportunity because they have not yet developed a use disorder or experienced any harm. Next slide. So I'm not a graphic designer. This is not the prettiest slide. This is my attempt, though, to graphically show the connections between stages of health and the behavioral health spectrum. So again, because primary prevention is for audiences that are not yet experiencing any sort of disease, injury, or disability, that is our universal and selective services, because to our knowledge, there's no use occurring in those audiences. Secondary is, oh, we have a concern. There's some use happening. They don't have a use disorder yet, but it's an opportunity to get them back into a no or very, very low use pattern. And then tertiary is the services that are there to help people once a use disorder or a mental health problem have really taken root. And the goal is get them better, stop them from getting worse. So you're looking at both the actual treatment services and additional services that support their well-being throughout their recovery journey. So I hope I got that in 5 minutes. I'm not sure I did. So my apologies if I went over, but that's it.
Thank you.
Yes, I did cite references and have contact information.
Thank you so much, Alyssa, for a fantastic presentation. I am wondering if my fellow committee members have any questions for Alyssa. I had a couple, if that is appropriate. So, Alyssa, I was wondering if you could talk a little bit about sort of how we address some of these prevention concerns, specifically around like evidence-based programs or evidence-based interventions, and the role that they play in addressing the universal selected indicated primary, secondary, tertiary.
Yeah. Well, for me, the most important thing is to start with your data and, really use your data, including qualitative data. I'm a huge mixed methods person. So the numbers and the stories combined to understand what is really driving the problem in a community. So, and it might be different from substance to substance, but sometimes it really is kind of the same set of risk and protective factors and local conditions. And to me, when it comes to identifying your strategies that you're going to do, there's a couple things that are really crucial. And one is understanding that one intervention will never do it, because substance use disorders are multiply determined. There are multiple factors that converge in a very nefarious way. It is not simply like we like to think, oh, kids get bored and they experiment. There's usually more to it than that. And it's really important to take that seriously, to take the risk and protective factors seriously, and look for interventions that align with what is truly contributing to the problem. So you don't have a mismatch of your problem and your solution. Matching that matters, and having kind of attacking the problem from multiple angles matters. So you want universal strategies, but you're going to need a combination of selective and indicated and your tertiary. You really need services across the whole spectrum. My friend and colleague Kevin Haggerty, he works at the Social Development Research Group, and he always says, well, prevention's so under-resourced though. So then it becomes even more critical to pick very effective strategies. So looking at the research of what's going to work, looking at what population it was tested in, and being honest about, is that my population or not? Because it might not be. Risk and protective factors do vary across cultural groups, and that's important to keep in mind. And so knowing your community, knowing the populations you're working with, making sure you have members of those coalitions, not just at the table, but really in the end leading the way, because they're going to know better than people outside of that committee what's going to work and what's not. So making sure you've got members of that community at the table with their voice being heard and listened to and respected, and then making sure you're matching strategies. And the other challenge in prevention is just resources. Do you have the right resources? Do you have the right skill set? Do you have colleagues who can build that capacity? to actually do the interventions the way they're intended. So that, I don't know if that answered your question. That was a lot. Prevention is not easy. There's so much that goes into it, and it takes a massive team to do it.
I couldn't agree more. Thank you so much. Other committee members, questions for Alyssa and her expertise while we have her?
Jessica, can I ask a question? I'm sorry, I don't have the thing.
Go
This
ahead.
is Debbie Nadler for the record. I do have a question and I'm not sure. Thank you so much for giving us that information. Do you know, or does somebody on here know? I thought Governor Sisolak mandated mental health in all our classrooms before COVID. I thought, I could be wrong, but I could have sworn he mandated programs for the classrooms in December of 2019. My question is it because the schools I've talked to, I don't see mental health specialists in them. I mean, unless they're in only certain schools.
So
If that made sense.
I'm personally not aware of that mandate. I hadn't heard that. I would refer you to Christy McGill at the Department of Education. I know she's working on some systems level change that include getting, better mental health services, both promotion and treatment into classrooms. She would be a resource for that.
Okay, thank you.
Thank you for your question, Debbie. Other questions from committee members? I have one more quick one if we have time, Ms. Rodriguez. Great. Alyssa, my last question is I've heard the adage that no prevention is better than bad prevention, and I was wondering if you could speak a little bit to that, and if that's true.
Well, I have to say the thought of no prevention just absolutely breaks my heart. But I will say bad prevention does harm and is going to make it worse. And so, maybe there is truth to that. I've actually never heard that adage, but I can think of several interventions that simply should not be done because of the harm they do. I was talking with somebody who was very, very new to prevention, and they were asking me, what about the faces of meth? And I said, well, from a brain development science perspective, we know fear-based messaging doesn't work, scare tactics don't work. There's always going to be a small number of kids who it does work with. I was one of the kids that, scare tactics worked with me, but they don't work with most kids. We have to be honest, they don't work with the majority of kids. But the other problem with that is it stigmatizes people who do use meth and need treatment. And in prevention, we cannot be a part of the problem. We cannot use interventions that stigmatize, especially when they don't even work. So, maybe there is truth to that adage.
Thank you for your question. Any other questions from committee members? Wonderful. Well, thank you so much, Alyssa, for your presentation today and being flexible to hop on our training. I know that this information will go a long way in the recommendations that this committee is charged with making around prevention, and really grateful for your leadership today.
Thank you. I'm just going to drop my email in the chat in case anyone has questions later, and then I'm going to step away from the call now. Thank you for having me.
Thank you so much.
All right, bye-bye.
Wonderful. Thank you all for being in that with Alyssa, and a great presentation there. I wanted to move on to agenda item number 5. This is a review of the 2023 subcommittee guidance. So myself and Ms. Rodriguez will be just sort of going through the discussion points here. So as first pieces here, subcommittee members were asked to submit recommendations through the fantastic survey provided to us by the SEI team. And these would be recommendations that you are welcome to present on your own whenever possible for full discussion. Or if you have a recommendation that you don't feel like you're the subject matter expert on, providing that specific person would be most beneficial for staff to this committee to ensure that they're able to reach out to the appropriate person to give a brief 5-minute presentation on the recommendation with time for questions following the presentation, much like we saw today. So additional pieces continued. We're asking folks not include recommendations that are in the 2022 SURG report. The SEI team has attached that to today's meeting if there's any reference that folks need for what was included in the 2022 SURG report. However, if we needed something that had a further research or additional research or maybe new developments to a recommendation that came out, obviously that could be considered for a new recommendation here. Rather than an iterative waiting process, the hope of this SURG of the prevention subcommittee is that we're going to present and discuss recommendations as they're coming up as part of these meetings. And then at probably our last meeting, Emma, is that I think the recommendation of the last couple meetings that we'll be able to review and wait and finalize them in advance of the fall report. Per our conversation today, or apropos to the presentation we just heard, we're looking for a comprehensive view of primary, secondary, and some tertiary activities. This committee will also be tracking the harm reduction activities that we heard yesterday. It took place in April. So a big charge, in my opinion, to this group, but I think that we're up for the challenge. And I do believe that Attorney General Ford also is looking for recommendations outside of the more narrow scope of opioid recommendations that we heard in the last go around last year. So this committee is charged with very broad recommendation opportunities. Any questions so far on the subcommittee guidance before I turn it over to Emma for the survey feedback? All right, Ms. Rodriguez, the floor is yours.
Thank you. Emma Rodriguez for the record. So I'm just going to quickly review the results of a survey that was distributed at the beginning of the year. So we wanted to take a look back at how the previous year had gone. It was the first year. We knew that there was a lot of learning and growth that happened. So just to quickly summarize, people reported what worked well. Largely the subcommittees was what we heard. People thought that we were able to cover more ground and move things along in the subcommittee. They liked the prioritization process and having that kind of deeper discussion of recommendations in the subcommittees. They also noted SEI coordination and staff organization as something that worked well. And then additionally shared documents to compile information. So I'm thinking that's those recommendations, spreadsheets, maybe the survey process is wrapped up in that. And then we have a very long list of what could be improved, which is great. So one person had recommended more presentations on contested recommendations at the SURG. So I'm thinking that would likely happen more towards the end of the year as the final report is wrapping up. They also wanted better definition of subcommittees or a full SURG meeting dedicated to the crossover recommendations. They wanted the clarification on the recommendation ranking process, which is something we try to do with the guidance that Jessica or Chair Johnson just reviewed. There was a request for more predictable schedule of meetings, especially for subcommittees. We do have all of the subcommittees now on, they're all scheduled out through the fall, I believe. So hopefully that should be a little bit more predictable for everybody. It was requested for the length of the meetings to be shortened to 90 minutes or less. That is why we have tried to impose 5 minutes for a presentation. I know that's super tight, but we're aiming to do that so we can get the top information that we need and allow for enough discussion, and also try to keep the meetings to an amount of time that's accessible for everybody who also has other jobs to get to. There was a recommendation to address harm reduction in its own separate capacity, or having a harm reduction specific subcommittee. As most of you know, we had that harm reduction full SURG meeting yesterday, and as Chair Johnson mentioned, the prevention subcommittee can be taking those recommendations to refine them. There was a suggestion to ask SURG members what they would like to learn from presentations, and to have more presentations from providers instead of from the state. I think that was also reflected in yesterday's meeting, where we really tried to ask the members who they wanted for recommendations for presenters, and then just better adherence to public comment period time limits. So as Chair Johnson mentioned, I try to have that timer app up so we can time everything, and we're doing our best. And of course, always welcome any feedback you have, both what can be improved and what's working well.
Thank you, Ms. Rodriguez. So from Search Prevention Committee members, do you have any additional feedback from our process before we really dive into the 2023 recommendations and submitting process this year, or any lingering questions that we can discuss at this time?
I'm sorry, Jessica, it's Debbie Nadler for the record. I do have a question. It's I especially from the other day, being on the harm reduction committee, that was somebody, if I wasn't mistaken, from California, doing a presentation for us, and maybe I'm confused, maybe I haven't slept enough or whatever, but we're taking, I don't understand. I thought this was for groups in our state. The person yesterday that was talking about, let's just say, the PIPE program he's doing, are we making recommendations for other groups in other states to be here, or we're supporting them in California? I'm sorry, I was confused on that.
That's a fantastic question, Debbie. I think I can try to answer that, and maybe Ms. Rodriguez, if you have anything to add. I know part of your team was coordinating presentations. My understanding, and this is Jessica Johnson for the record, my understanding is that whenever possible, the expertise from the state, from folks inside the state of Nevada to present on the recommendations was prioritized for yesterday's meeting. And then if there was not an expert that was able to discuss those recommendations, that committee members maybe recommended a national expert or some other person to discuss the recommendations from the committee members. I feel like I'm double speaking. Apologies. Ms. Rodriguez, would you add anything to that?
Yes, Emma Rodriguez for the record. So I would just say that, yeah, we asked members to suggest folks to present, and as Chair Johnson mentioned, whenever possible, we try to have them from our state, but there's also a learning opportunity to see what other states are doing. So that was where the California presenter came in. I know we also had somebody, I believe the group was called SANE, located in Western Massachusetts, but we tried to follow that up with Marco from the Southern Nevada Health District to specifically show what Nevada is doing. So wherever possible, I think it would be helpful to, if we do have a national level speaker, to try to balance that out if possible with what's happening in Nevada, because I I think I'm hearing your point, Debbie. I will note this is a little preview for May, we do have somebody from the DEA from California. That's one of your recommendations, Debbie.
Thank you. Yes. No, I just was making sure that we weren't giving money to another group in California. Or, I mean, not that we decide. I just wanted to make sure we weren't making the recommendation to support this specific person who was speaking in California. That's what I meant. I know I didn't get the question across correctly, but
Jessica Johnson, for the record, thank you for raising that. I really appreciate it. And I think we can be additionally clear about that for future presentations. So thank you. Eric, I see your hands up.
Yeah, hey, hello, everybody. I'm so sorry about not hopping on earlier. My head was somewhere else, and then I looked at the calendar. It was like, oh no, I'm missing this meeting. So apologies. So I had thought about this recommendations process. What would be the most effective for us? I don't think it's to completely every year have a brand new slate of recommendations. I think if we do that, we're going to confuse lawmakers and policymakers and decision makers. If we have 10 recommendations from last year and 10-year recommendations this year and 10-year recommendations in the following year, it's just too many recommendations, I think, for people to follow in my mind. And maybe I'm wrong, I'm just one voice. But in my mind, what we do is we look at the recommendations we've already made and we try to, I think, ascertain what sort of progress, if any, is made on those in this current year, now that those have been introduced. And then we weigh whether or not those should be re-recommended or continued into the new slate of recommendations that we'll be making next year. Does that make sense?
Jessica Johnson, for the record, I think that makes sense, Eric. I would then presuppose that we'll probably need to put those into either the survey or have them be pre-populated and on the spreadsheet for review. To ensure that we're tracking any progress on those areas, whether they be through legislation or otherwise. And then I also too want to reflect that Chair Ford's feedback to us was to add additional recommendations beyond sort of the more narrow opioid scope,
Right.
which many of those were inclusive of.
Yeah, I'm sorry, I didn't mean to interrupt you.
No, you're fine. Go ahead.
Yeah, Eric Schoen, for the record. No, so I imagine that, I mean, in reviewing those, that we wouldn't just end there. We would also be bringing new ideas and new recommendations on top of those. I just didn't want, I could see a situation where if we didn't pay attention to what we'd recommended before, we'd end up with so many recommendations that nobody would know which ones to follow. And it wouldn't feel like a cohesive, I guess probably for me, the biggest part of this is I want this to feel like a cohesive direction. A very well lit neon sign, like go this way, this is where we want you to go. And I think we can do a lot with that by making sure we're underlining consistency in our recommendations.
Thank you for that feedback.
Chair Johnson, can I make a comment?
Yes, Ms. Rodriguez.
Emma Rodriguez, for the record. Thank you, Eric, for your feedback. I think this is something that the subcommittee might consider reporting out at the July SURG meeting, because it does, I hear your point, Eric, it does kind of go against the guidance that was given to all the subcommittee members, and that was decided in consultation with Vice Chair Lisa Lee about not including recommendations that were in the 2022 SURG report. But there, as you can see in this bullet, if there's additional research, or maybe if the recommendation is built out with a little bit more specificity, then I personally don't think that then it would be the exact recommendation. So I just wanted to note that.
Chair, may I respond? Okay, yeah, so Eric Schoen, for the record. So I respect that. I think I can kind of see they don't want people to just become non-creative and fall on what was already introduced. I think that's part of it, but I'll argue the other side of it, which is, for example, community health workers, which you guys know is my huckleberry. And it has taken a single laser-like focus over 10 years, if not more, to get to the point where we're at now. I am not confident that just passing SB 117 is going to take care of it, right? There's going to be more that needs to be done if what we're trying to do is really build a viable, strong level of paraprofessional care and accessible care throughout Nevada. So continuing to be able to amplify that will be really, really important. That's the part that I would like to make sure that we have some consistency with. And then at some point in time, maybe we get to a level like, hey, we finally have enough. We can take this one off the list, but I don't think it's going to be 1 year and then we're done with that.
Jessica Johnson, for the record. Thank you, Eric. I really appreciate that comment. And I also think as members of this committee turnover in future years and there's change there, that also allows for some continuity to that. So if we can let the record show that we'd like to talk about this at the July meeting as maybe the main point out of the subcommittee.
Yeah. I think that's a worthwhile conversation.
Wonderful. Thank you for the feedback. I really appreciate it. Any additional feedback from the committee? All right, hearing and seeing none, let's move to agenda item number 6. So this is a review of the AB 374 Section 10 requirements specific to the Prevention Subcommittee and the recommendations in the 2022 annual report. So to reference for everyone here, and these are included in the survey where recommendations are populated. These are the areas of the subcommittee that we're charged with looking at. So evidence-based, I'm going to summarize them here because
Chair Johnson.
Go ahead. So go ahead.
Emma Rodriguez, for the record. I just wanted to clarify, these are the cross-cutting elements that are assigned to all the subcommittees. The next slides will be just the ones that are specific to prevention.
Thank you for keeping me honest.
I know it's a lot of words on the slide. I apologize.
Yes, in the interest of time, I am maybe going to paraphrase some of these, but they are on the slides and out for public records. So assessing evidence-based strategies for preventing substance use and intervening to stop substance use, and assessing and evaluating existing pathways to treatment and recovery for persons with substance use disorders, including members of special populations. And additional cross-cutting elements are examining qualitative and quantitative data to understand risk factors for special populations, and making recommendations to the Department of Health and Human Services concerning the use of the money described in Section 10.5 of this Act. As the Prevention Subcommittee, thank you, Ms. Rodriguez, for making sure I'm on task over here. The Prevention Subcommittee specific sections are Section A, leveraging and expanding efforts by state and local government entities to reduce the use of substances. G, making recommendations to a variety of entities, which I would like to see from the recommendations that come out of this committee going forward. And then G, studying the efficacy and expanding implementation of programs to educate youth and families. This may continue on the next slide. And leveraging efforts again to expand those around state and local government with very without limitation in terms of substance type. Anything to add on this slide, Ms. Rodriguez?
No, sorry. I think I clicked off that one too soon. So the next set of, Emma Rodriguez for the record, this next set of slides are, it takes those prevention subcommittee assignments that you just reviewed, and it in italics, it has the recommendations that were in the 2022 report. So you can see how they lined up. Not all of them came specifically from the prevention subcommittee. Some of them were combined. As you remember, there were some overlapping recommendations with the other subcommittees that were melded together. So that's why you might see treatment and recovery on some of these slides.
Wonderful, thank you. And for committee members, this is, I think, an opportunity for us to just kind of do some refresh back to 2022 regarding the recommendations and our sort of charge as the prevention subcommittee. So you can see here 2 recommendations around around letter A. We can move to the next slide. A harm reduction recommendation around letter G. And another prevention subcommittee recommendation around letter J as well. So sorry, before we move to number 7, I just want to see if there were any questions from the group. I am hopeful that these slides can be a reference to subcommittee members as we look forward to either adding new recommendations in 2023 or our alignment with these areas as we look at recommendations for 2023 based on what we came up with last year. Any questions or comments from the committee before we move to the next agenda item?
No questions from me, Mr. Chair. Eric Schoen for the record.
Thank you. Great. Thank you for putting these together for reference, Ms. Rodriguez. All right, let's move to agenda item number 7, the 2023 legislative session update. So, Ms. Rodriguez, I may call on you to walk us through some of these. The purpose of this legislative update is to have on the record some of the bills that are related to recommendations from the prevention subcommittee the last time around.
Yeah, Emma Rodriguez for the record. So this was also posted as a meeting material. SCI plans to update the I forget what the document itself it's called. I think it's Substance Use Bills 2023 on a monthly basis. So the document that's posted to the SURG website was updated as of last Friday. So I think some of the bills have been heard now that said it wasn't. So it's not totally up to date, but at least you should have most of the bills that we think align with the SURG recommendations. And as Chair Johnson noted, it's really for the committee to be able to track what is moving in the legislature that aligns with recommendations or those A through Q items. This first set of slides is bills that align with these, I think it's A, G, and J that's assigned to the prevention subcommittee. So there's SB 117, which expands Medicaid coverage to community health workers. And you can see that aligns with 2 recommendations from last year's report to expand Medicaid for preventive services and access to care. And then number 15 was on those community health workers that Mr. Schoen had just referenced was so important to him. The document that's posted has additional detail about the bill, and you all likely know more about this than what's just on the slide. This is just a high-level overview. SB 119 extends coverage for telehealth services. There was a SURG recommendation number 11 to expand access to MAT. and STD recovery support, including telehealth. And then SB 191 would expand Medicaid coverage to behavior analysts. And that is aligned with SURG recommendation number 6 on expanding Medicaid for preventive services and access to care. And then here are some assembly bills. So AB 138 would expand the state plan for Medicaid to cover evidence-based behavioral health services. That's also aligned with SURG recommendation number 6. And then AB 156 would ensure availability of medication-assisted treatment in jails, detention centers, and correctional facilities, and for people diagnosed with OUD, and continuation of treatment on release of transfer. And that aligns with SURG recommendation number 11. And then again, please see the that full document for a list of full bills that have been identified that overlap.
Thank you, Ms. Rodriguez, for covering, just Johnson for the record, thank you for covering and summarizing some of the key legislation updates related to the recommendations out of this committee and other committees of the SURG. I wanted to just pause for a moment in case there were other bills related specifically to any of the SURG subcommittee recommendations that folks on this group are tracking and referencing that we can make sure are added to any future updates.
Ms. Johnson, Ms. Chair, Eric Schoen for the record. I would just speak to SB 117. There is a work session next week. My understanding is all the needed conversations have pretty much been had, so it should be smooth sailing. I'm really confident about this bill, in part because it's sponsored by Senator Doniate. I think it has a really good chance of being approved and seeing the light of day. So fingers crossed. My understanding during a work session, folks from the public can't participate. We're welcome to watch, but we can't actively participate in the work session.
Jessica Johnson for the record, thank you for the update, Mr. Schoen, on SB 117. And so if there are no additional updates on bills, I also would welcome any input on how tracking the legislative session updates related to the SURG could be beneficial for this committee going forward. If a high level overview and opportunity for discussion is the best format, happy to continue in that fashion, or open to any subcommittee members' input on how to make this beneficial.
Ms. Chair, Eric Schoen for the record. Honestly, because I am this year not trying to be super involved, because it's a really deep pool to jump into when you're actively involved. So I appreciate just the fact that there are people tracking this at any level and trying to keep this in front of us. So my appreciation for that being done.
Jessica Johnson for the record, thank you, Mr. Schoen. I agree. A very deep pool this time around. So if committee members have any additional input on how to make this even more beneficial going forward, staff to this committee and myself as chair are open to that input. So thank you. All right. Seeing no moves for further discussion, I think we can move to the next slide. Wonderful. So agenda item number 8 is an overview of the recommendations we've received so far and next steps. So far, our subcommittee has received one recommendation from member Nadler on the DEA's community outreach section. So the committee is prepared to hear a presentation at our May 15th meeting regarding this recommendation from Ruth Morales, who's the community outreach specialist with DEA related to this specific recommendation. So I'm hopeful if there's anyone who has any additional recommendations that they'd like to surface at this time during the meeting, or anything that we'd like to discuss and workshop.
Mr. Chair, Eric Schoen.
Yeah.
Oh, sorry, go ahead, Debbie.
No,
Okay,
no, go
Debbie.
ahead. If
okay.
I could go first, I'm so forgetful. I'm so sorry.
That's okay.
Go ahead,
I'll take
Debbie.
Debbie and then Eric.
Okay, I'll just take a quick second. I would like to see if we can get Joseph Engel with the 10 High APG as a presenter. He's doing wonderful things for Southern Nevada. He helps with alternative peer group. He contracts out with I forget, Harbor House, sorry, the harbor, and he's get an overwhelming amount of kids coming in, and he provides services for free. He's not getting funding, and he's doing so much within our community. Everybody knows Joseph Engel, but I'd like to recommend that we have Joseph Engel with 10 High APG give a presentation for the next meeting, if you don't mind.
Thank you for the recommendation, Debbie. Do you or intend to also submit a recommendation specific to the SURG subcommittee related to 10 High's work? Or is that something we could ask Mr. Engel to include in his
Yes, he will. Joe said he will. He'll include whatever you need.
Okay, wonderful. Emma, you can connect with Ms. Nadler about contact information for Mr. Engel. Thank you. And if Jessica Johnson, for the record, if we're not able to schedule him for the May meeting, we'll do our best to work around other schedules as well.
Thank you so much. Thank you, Eric. Thank you.
Oh, yeah, no worries.
Go ahead, Mr.
Thank
Schoen.
you for, yes. So for the record, Eric Schoen. My understanding is that the price of chromatography spectrometers is dropping. I would be interested if somebody has good information on that. I think there are some units that don't require a whole tabletop, or at least even kind of approximate spectrography, if I'm even using the right words. But I've seen something like a, I don't know, a little portable, almost like a laser gun that's kind of used. I don't know if that's even point of what I'm trying to say. Obviously, I'm confused. It'd be nice to have somebody who could present on what the options are and maybe how the technology is evolving. Because if that price point drops far enough, then I think it bodes well for us being able to disperse those far and wide into the communities we're trying to serve.
Thank you for your comment, Member Schoen. To clarify, is this recommendation for a presentation specifically around drug checking?
Right. So, it'd be a way of knowing whether there's fentanyl in the opioid supply, or if there's xylazine, if there's adulterants that we folks would need to know about, but it'd be a way of being able to test that.
Terrific. So your recommendation is someone who can speak to the different types of mass spectrometry involved in drug checking, and maybe the pros and cons of the different types of approaches and the cost.
You make me sound so much better than I do. That is spot on. Yeah, all of that, and somebody who's up to date with the latest technology for where we're at, what the options are. Great,
wonderful.
Great.
Thank you for that recommendation. It also sounds like, Chair Johnson, for the record, that aligns with some of the recommendations we heard at the harm reduction meeting yesterday. So perhaps that would help this committee additionally workshop any recommendations around that as well.
Yeah.
Great, thank you. Any other additional recommendations or suggestions that would relate to future recommendations that anyone is planning? This is Jessica Johnson for the record. I am working on a recommendation around, I'm not even going to be prepared to say this today, so apologies in advance. Maybe Mr. Schoen can rephrase whatever comes out of my mouth next for the record. Looking at alcohol outlet density and some recommendations around how this committee can help to advise and look at those indicators going forward. My brief understanding of alcohol outlet density is it's connected to a lot of social determinants of health and other outcomes related to prevention and even mental and behavioral health in some of the research. So I'm happy to work with staff to this committee to see if there's someone who can speak to that and also provide a firm recommendation around alcohol outlet density if the science and the pieces indicate that. Terrific.
Well, and Chair Johnson, for me, my mind goes to the flip side of that, right? Imagining communities with robust natural supports and plenty of parks and places to go that don't involve alcohol. So, you know, I think that's kind of the gist of the prevention committee's work is how do we have that be the most prevalent thing that's happening in communities so people can come into contact with that and be supported by those healthy kinds of options. So yeah, I don't know where in the middle of that there might be opportunity for presentation or more discussion, but that to me is the vision towards which we're really orienting ourselves.
Jessica Johnson for the record, thank you, Mr. Schoen. I definitely see that as the neon arrow light as well, pointing hopefully more upstream. So not only a half-baked idea for consideration today, but hopeful to identify someone who can speak a little bit more eloquently on it and perhaps provide a recommendation.
Yeah.
Thank you. Any other discussion on this agenda item? Wonderful. Ms. Rodriguez, does the SEI team feel like they have what they need for the May meeting?
Emma Rodriguez for the record. I'm pretty sure I can get Joseph's, I think I have his contact information. If not, Debbie, I will reach out to you to get that. I think
Thank you.
Yeah, I will just need help from Eric and Jessica on the people I should reach out to. And so I'll be reaching out on that for the 2 presentations that you both recommended.
Perfect.
Thank you, Ms. Rodriguez. If there's no further discussion on agenda item number 8, let's move to agenda item number 9, which is our final period of public comment. Again, limited to 3 minutes per person. And this can be on any matter that's not specifically included on the agenda at this time. And as a reminder, no action may be taken upon a matter raised in public comment. If you are attending online, feel free to use the raise your hand function to help staff determine who the order. But if you're not able to access that, Emma can also take a list of folks as well.
Jessica, Debbie Nadler for the record. I just want to tell you, you did an amazing job. You look like old hat. You've done this forever. Thank you so much.
I'm not permitted to respond to public comment, so I won't say thank you.
Hey, Debbie, I think you're onto something. If she can't respond, then she just kind of has to take the compliment. So for the record, Eric Schoen, I would echo Debbie's comments. Very well run, very respectful, very inclusive, very encouraging. It was a lot of fun.
Thank you. Anyone else for public comment?
This is Laura from PACE, and I just want to thank you guys for your effort and your commitment to getting this handled and done. I totally understand the bad prevention is, you know, worse than no prevention, but the fact that you see it as a priority and are willing to work on it, the coalitions are really thankful for that part of it, and the state and all our service areas.
Thank you, Laura. Really appreciate you being here. Anyone else for public comment today?
Chair, I'm not seeing anybody raising their hands.
Wonderful. All right, thank you to those who provided public comment today. With that, we'll move on to agenda item number 10, which is to adjourn. So thank you to the committee members and to all attendees, the SEI team and the DAG for being online today. Really appreciate
Thank you. Thank you.
Take care, everybody.
Wonderful.
To hang
Feel better,
up.
Debbie.
Sorry. Thank you. I'm trying to hang up. Sorry. Thank you.
Take care.
Got it.